Well, good morning, everyone. Can you all hear me okay? All right, so I want to thank you all for the excellent introduction, and I'm extremely honored to be invited to speak today at the Health Watch USA conference, and particularly to follow one of the most incredible women physicians and leaders and advocates of our time, Dr. Jocelyn Elders. So my name is Dr. Leana, and I'm an emergency physician. Having been a patient as well as a caregiver, I'm passionate about the issues of patient advocacy and empowering patients to get better care. And as was mentioned, I'm the author of the forthcoming book, When Doctors Don't Listen. And I'm speaking to you today about how to avoid misdiagnosis and unnecessary tests, a patient's guide. So as a physician, we're privileged to hear the stories of our patients, and I want to begin by telling you a story. It's about a mechanic named Jerry. You don't know Jerry, but you might know someone like him. Jerry is 42. He's a little overweight, not in the greatest physical shape of his life, but he's been busy raising his family and running his auto business. Over the weekend, he helped his brother move some heavy furniture, and he wakes up in the morning with a slight twinge in his chest. He thinks it's probably a muscle pull, but when it doesn't go away throughout the day, he's a little bit worried. And so he goes to the ER to get it checked out. So in the ER, he's seen by a nurse who seems worried about his description of chest pain, and so tells him that they need to activate the chest pain pathway. And what that means apparently is that he gets some blood work done, he gets an EKG, and he gets a chest x-ray. At some point, a doctor comes in and says, well, I don't think you're having a heart attack, but can't really be sure, so you gotta stay overnight. And Jerry says, well, I feel fine. I don't really want to stay, but he has to do what his doctor says. As we heard, that's something that patients don't really feel like they can disagree with their doctors about, and so he stays overnight. And the next morning, he gets more blood drawn, an EKG done, and a treadmill test. At the end, the doctor comes in and says, well, you're fine to go. But Jerry doesn't understand, because he still doesn't know what he had to begin with. And he doesn't understand why he had to stay in the ER the entire time, and also why he wasn't involved in the decision-making process about himself and his own health. And so I want to ask you all, how many of you have had an experience like Jerry, where you go to the doctor and you're told what you don't have, and not necessarily what you do have? Okay, and how many of you have ever had a test done where you don't know why you had the test done? Okay, and how many of you have left the doctor with fewer answers than you came in with to begin with? Okay, so the problem is not just that Jerry had unnecessary tests, many of which may have bad side effects. It's not even that the tests are expensive, although you know as well as I do about the escalating costs of healthcare, and we'll hear a lot more today about the consequences also of over-testing and over-treatment. It goes to something even more fundamental, which is that the doctor isn't listening. The patient isn't involved with his or her healthcare. And I say doctor, but I also mean healthcare providers in general, that we all kind of face this problem. And also that doctors and patients are increasingly disconnected from each other, frustrated with more testing and more treatment, but actually getting far fewer answers. You know, I went into medicine because of my own childhood experiences with illness. When I was growing up, I had really severe asthma and also a disabling speech impediment. And I wanted to be a doctor from the time that I was really young so I could help people and really heal those in need. And I think many of you in the health professions, you know what I'm talking about, that pretty much all of us in this field, with very few exceptions, mean well. We want to do the best by our patients. But there are a lot of pressures that may not have existed before. Doctors are now pressured to see a lot of patients with very little time. There's the pressure to use technology and rely on technology rather than talk to patients and learning really how to communicate. Also, our medical training nowadays do not so much emphasize listening to patients, communication, cultural competency, as Dr. Elders was talking about, but really on high technology and on science, which is important, but may not really get to the bottom of what's plaguing our system. As a result of this, doctors have begun to practice what some call cookbook medicine, which is relying on recipes and pathways, not personalized medicine, not individualized care to the person, to the individual patient. And patients are not speaking up to their doctors about it, even though so many people have stories, like Jerry, who leave their doctor confused and frustrated. So there's an even worse consequence potentially than too many tests, and that's misdiagnosis. So I want to tell you about my mother. This is a picture of our family taken several years back, and my mother, my father, myself, and my sister. So my mother was born in China, and we immigrated here, living in pursuit of the American dream like so many others here. She was a teacher in some of the roughest schools in Los Angeles. And when I was a second-year medical student, and she was in her late 40s, she began complaining of a cough and feeling run down. For 6 months, her doctors reassured her that probably what she had was a virus. And they said, well, she's a teacher, so, so she was exposed to all these kids. But she knew that something was wrong, that she had never been sick like this quite before. She was getting all kinds of aches and pains in her body. And it wasn't until over a year later that she was diagnosed with widely metastatic breast cancer. And all along, she knew that something was wrong. She just didn't speak up to her doctors, even though she was a highly educated woman. And I was a medical student and knew something about the healthcare system. I felt powerless to help her, and she felt powerless in this whole vast medical system. So you all know that misdiagnosis happens every single day in our hospitals, in our clinics, in our ERs, in our inpatient wards, in our ICUs. And as was mentioned too, there are over 100,000 deaths every year from medical error. Most medical errors are errors in diagnosis, meaning that diagnosis and getting to the issue of why you have this illness in the first place is really critical. Now, studies have shown that over 80% of diagnoses can be made based on history alone, and yet doctors are listening less and less. So what does that tell us? Well, certainly doctors have a responsibility, and all of us healthcare professionals have a responsibility to be better communicators, safer in our practice, preventing infections and all these things too. And we all know that the healthcare system also needs to be reformed too. However, what I emphasize is that all of us as patients cannot afford to wait for our doctors to improve and our system to be reformed. Your health and that of your loved ones is at stake and on the line. And so patients have to speak out and speak up. Patients have to ensure that doctors are listening. We have to be active advocates in our care, to challenge doctors, to be equal partners, to make sure that we get to the right diagnosis. And these are all the things that we need to do to make sure that we're really equal partners in something that affects us. And so I want to present to you today the 5 things that you can do to empower yourself. 5 tips. Number 1 is to establish an equal partnership with your doctor. Now, if you have a choice of doctors, that's great. Dr. Abu Salam talked earlier today about the different websites that you can use, the different groups that are starting to rate hospitals and rate doctors, and I think that these tools are absolutely critical. And there are lots of things that you can look at, the clinical outcomes as mentioned, but also how your doctor is as a communicator. Of course, not all of us have that choice. Sometimes you may be in the ER in the middle of the night and there's only that one doctor on. Or your insurance may not pay for that many doctors, or you don't even want to switch doctors because you've had the same primary care doctor for a while. If that's the case, there are still things that are within your power. The key, first of all, is to make sure your doctor knows that you expect an equal partnership. Doctors aren't mind readers and are probably used to patients taking this passive backseat to their care. And so it's important, no matter if your doctor is a new doctor or one you've had for a while, to say at the beginning of your visit that you want to partner in your decision-making process. And along the way, ask to share in your doctor's thought process about your diagnosis and your treatment. Say that you want to know what your doctor's thinking, because you're entitled to, right? This is your body and your health. Number 2, because a key goal in your medical care is to get to your diagnosis, the second way to empower yourself in any medical encounter is to focus on that, focus on your diagnosis. A lot of patients will say, well, why is that the case? Well, the diagnosis is critical because before you can treat something, you should know what it is, right? I mean, you should know what your diagnosis is. Otherwise, you're just throwing medications or throwing tests at something without knowing and potentially masking the symptoms. Also, diagnosis is important because then you know what you have, so you can know what to expect. You know, if you know that, like Jerry, if he was told he had a muscle pull or muscle strain, he would know what are the medications he should take, what are the things that he should watch out for, and what to expect if that is the diagnosis that's given. Actually, I go so far to tell my patients that they should never leave the doctor without knowing the diagnosis. I'll say that again, do not leave your doctor without knowing your diagnosis. And again, some people will say, well, how is this possible? I mean, not always can you know your diagnosis. However, when your doctor or your nurse practitioner or your PA or somebody is seeing you, without doubt, they know, they think that there are several things, at least they know what are the 2 or 3 things that they're considering. So you should assure your doctor, even if you're not 100% sure, please tell me what it is. You are entitled to know what your doctor's thinking. So even if they're not 100% sure of your diagnosis, you should still ask what that may be. Number 3, make sure your doctor is listening. Remember again that over 80% of diagnoses can be made based on the history alone, so not listening can lead to grave errors. And then if your doctor doesn't listen to you, how could you be sure that their diagnosis is correct, right? How could you trust that they have the information that they need in order to diagnose you? And so there are some ideas, there are some ways to help your doctor help you, including knowing how to tell a good story. And this again is something that I get questioned on because some patients will say, well, why is it up to me to tell a good story? You know, isn't it the job of the healthcare provider to find out and to be a better communicator? And again, the answer is yes. I mean, you would want the ideal doctor who can get you the best care possible. But if you're not able to find that ideal doctor, or even if you have a great doctor, there are still some things you can do to help your doctor help you. And these things include telling a good story, such as beginning at the beginning. Using chronology is helpful for any type of a story, so use it in your medical encounter as well. Provide context. So often I hear patients say, well, my pain is 2 out of 10, and then it became an 8 out of 10. And I think that's the jargon that medical professionals use, and so they think that that's helpful. But it's so much better to say, my headache was so bad, I couldn't go to work for 3 days, and I couldn't get out of bed for the last day. I mean, that's quite telling, right? That's quite stark in your head. And so using your own voice is very important as well. And also because you only have a limited period of time to get your doctor's attention, it's also helpful to write down key details in advance and to rehearse it in the same way that you would rehearse a speech or something, because you only have a limited time, again, to get their attention for something that is really critical. Number 4, understand every test that is ordered. So every test should be done for a specific reason. Studies have shown over and over again that there is little use for the screening test. Getting screening lab work or screening CT just doesn't make sense. It's actually ineffective. It's like fingerprinting an entire city to find a suspect of a crime. You know, it's likely to not be particularly efficient and to also end up having confusing results. Not to mention that every test, even the simple blood draw, has potential harms. There are tests like the CT scan that have even more potential harms, such as increasing your lifetime risk of cancer. And that's something that, you know, I as a physician rarely used to tell my patients about. It's not something that we tell patients about the risks of testing. We may talk about the risk of treatment, but there are risks of testing as well. And so if your doctor says that you need some tests to be done, you should ask, first of all, what is the test? But then, what is it looking for? How is the test going to change management? If it's not going to change management, why are you doing it at all? Is the test even necessary? What are the harms? Again, every test has harms, so ask about that. And then what are the alternatives? So my 5th point that was mentioned earlier as well is to make sure that you ask all the questions before you leave. Again, you have a limited period of time with your doctor, so I would encourage you to come prepared with questions. Bring a pen, bring paper, write down questions as they come up. Also write down answers that your doctor has given so that you can look it up later as well. It often helps also to bring a trusted friend or family member because they can help to advocate for you. Perhaps they've thought of questions, or perhaps they can remind you of a question that you had and say, didn't you think about that before? Or didn't you have a question about this? And so it's helpful to do that. Also, some questions to ask. Again, make sure you know your diagnosis before you leave. So ask about, what is my diagnosis? What can I expect from my illness? What is the expected course, right? And then what can I do to get better? I mean, you go to the doctor because you want to feel better. You don't want to feel worse. So you don't want to be the same. So you should ask, well, if this is my diagnosis, or even if we're not sure what my diagnosis exactly is, what can I do to get better? And then what are the red flags? What are the warning signs that I should be watching out for? Let's say that you're not 100% sure about my diagnosis. How can I be sure it's not something worse? And what are the things to watch out for? I think these are really critical questions to ensure your good health. Finally, if something doesn't make sense right now, make sure to ask about it. As Dr. Elder said, so many of us don't speak out. We don't want to disagree for fear of looking like the bad patient. Have you guys ever seen the Seinfeld episode? I think Elaine was, she was upset about, or she was saying that she didn't want to become this bad patient or something. And I think that's a fear that so many of us have, that we don't want to be seen as the problem patient that everybody avoids. But there's such a fine line, I think, between being the patient who asks questions and partners in their diagnosis versus the patient who's really disrespectful. And I actually think that that's what it comes down to the issue of respect. If you're respectful of your doctor and you ask questions about your own care, that's the right way to approach it. And that's good for your care. And that's actually good for the doctor too, because your doctor, your healthcare provider, should actually want you to get to the right diagnosis as well. So all of this might seem a bit intimidating. You might be wondering, can you really become an empowered patient? And my answer is absolutely. And in fact, it's absolutely critical that you do so, because your body and your health are at stake. You know, your doctor, your healthcare provider, they have so many other patients to worry about, but you have yourself to worry about, and that of your loved ones to worry about. So it's really up to you to advocate to avoid misdiagnoses and unnecessary tests too. And if I have just one takeaway message also, it's that now is the time to get the health care you deserve. Right now, not when you're hospitalized and you're in significant distress, not when your family member is gravely ill and in a lot of pain. I mean, that's not the time to start thinking about how can I get the tools to get the best care. You know, your mind is occupied with so many other things. And so now is the time that you should be practicing these skills at every routine doctor's visit, because that's the time that you can really start advocating for yourself and building these skills that you need for when you need them the most. So in my book, which is coming out in January, I present the 8 pillars to better diagnoses, which are basically what I've discussed, but I also include 50 so-called prescriptions, which are how-to tips for how to get these, how you can apply this in your daily life. And then 21 exercises and some worksheets so that, again, you can become the empowered patient, the empowered consumer that you really need to become. And so what have we learned today? First, the bad news, that there are a lot of pressures leading to a less than ideal healthcare system, right? We know about the escalating costs of care. We know about the lack of quality and the lack of information that a lot of patients may have. We also know about cookbook medicine and the pressures on a doctor's time and the corporatization of medicine that, again, contributing to a system that's not ideal. And patients and nurses and nurse practitioners and doctors were all victims of this less than ideal system of care. But there is good news, which is that you as the patient can make a difference in your healthcare today. That there are 5 things that you can do right now. Establish an equal partnership with your doctor, focus on your diagnosis, make sure your doctor is listening, understand every test ordered, and ask all your questions before you leave. Basically, speak up and advocate for yourself. So every story has an end, and so I want to give you some follow-up on the people we talked about. Jerry, our mechanic at the beginning, is doing just fine. We finally figured out after going to multiple doctors that he has a muscle pull. But how long did it take for him to diagnose that? He not only had his overnight stay and all those blood tests done and the treadmill test, he actually also underwent a cardiac catheterization to figure out that he actually did not have blockages in his arteries. He had to go through multiple other treadmill tests to follow up on that, and he had some complications that included DVT, the deep venous thrombosis clots in his legs as a result. And so it took him a while, but he is fine. And he found out that he could have just taken Motrin to avoid this whole thing to begin with. And as for my mother, she did pass away after a 7-year-long battle with cancer. And what I do now is all in her memory. And I wish that I had those tools then, and that she had those tools then also to be able to advocate for the care that she really needed. And I know that she would have wanted me to share these lessons with you because you know, it's important that you have these tools to get the best care for you and your family. And hopefully these tools can also be useful for your doctor to become a better doctor, for your healthcare provider to become a better healthcare provider for their future patients as well. And so this is my website and my contact information. I'll be around during the conference, and so I'd love to be in touch during the conference and after as well to hear your stories and to get your advice and feedback. And I want to thank Kevin Kavanaugh and all the other organizers of the conference for putting together such an important event. And I want to thank all of you for your time and attention and welcome any questions that you have. Thank you. So I actually don't know if there is time for questions or not, but it's okay. I would love to have questions, to ask questions from the audience if there's time. So I think Dr. Kavanaugh, did you?
No, no.
Oh, sorry. Okay, 7 or 8 minutes. Excellent. So we have time for questions. And if you're thinking, again, this is the time to speak out. If you have a comment, I would ask you to see it as your responsibility to ask me that question, because very likely somebody else has that exact same question as well. Yes?
Do you fear that the fear of litigation plays into a lot of those decisions that are made to over?
Absolutely, absolutely. So I'm in emergency medicine, and I see this all the time, right, from my colleagues and my mentors who say, well, I'm ordering this test because I want to rule out, right, all these bad things, all these life-threatening illnesses. And I think that is very true. You do want to make sure that some of these life-threatening things aren't there. However, the patient can be involved as a partner in that process. Studies have shown, for example, in heart attack, that patient preferences about making sure they don't have a heart attack are very wide. Some say, well, I want to know, even if there's a 0.05% chance that I could be having a heart attack, I want to know. Some people say, I'd rather be home and I can follow up with my primary care doctor even if I have a 10% chance of having had a heart attack. So that's part of the shared decision making that we'll talk about later. But I think that by making sure that we speak to our patients, by making sure that we involve patients in that decision-making process, that could reduce the risk of litigation and the fear of litigation as well, because that becomes a shared risk and a shared decision made between the patient and the doctor. Yes?
Yes, Doctor, how can a hospital set up systems to help encourage this kind of communication between patients and doctors?
That's a very good question, because ultimately we do want system level change. And I feel like everything that I'm talking about today, it's almost like the stopgap. Like we want to do this in the meantime because the system isn't fixed, right? Like this is not ideal. You as a patient should not have to worry about all of this. Like you want for, right, like you're already sick and not feeling well. Why should you have to worry about how to be a better advocate? Like you want to focus on getting better. But so ideally you do want the system to change. I would say there are trends in the right direction in the sense that we are moving towards patient-centered care, family-centered care, and shared decision-making. However, a lot of hospitals are giving lip service and not necessarily incorporating this into their system and their structure. And so part of this for the hospital might include training their doctors and their nurses to be better communicators, giving time to this, and also making an active effort to educate patients who are there and saying, asking their patients for example, to write down their questions, to having set time during hospital rounds, to ask questions, to, I was just hearing a story from one of our affiliated hospitals' ICUs that supposedly they wanted all the family members to be present during rounds, but they would never tell the families exactly what time rounds were happening. And sometimes they would have rounds at 5:30 in the morning. I mean, who comes at, that wasn't even visiting hours. So how could you actually incorporate this? And so I think there have to be policies in place, but they have to be implemented in a reasonable way as well. That's very general, but I think that, there are many examples of things that don't work, and we need some better examples of things that do work to be implemented. Yes, sir.
I would like to know your thoughts on doctor accessibility through email.
That's a very interesting question. So I know many doctors who do it, and many doctors who don't. And I don't know what the practice pattern is here. In Boston, it's quite common, but I think maybe it's also because of the patient population. When I speak to patient groups there, because there's so many doctors in the Boston area, patients really do have a wide choice. And so maybe it's a different type of, different level of choice that we see. In general, I think it's a good idea to be able to have your doctor to ask questions too, especially because you may not know all the questions that you have during a patient visit. So intuitively, it makes sense to me to be able to ask your doctor questions over email. I don't think the reverse is necessarily true, that if your doctor doesn't do this, that means that they're a bad doctor. You know what I mean? Or that you shouldn't go to them. Because some doctors are afraid of the litigation aspect. Some other doctors are, because they're not paid for this time. Or, I mean, some of my friends who don't do this, they're actually afraid of patient safety issues, and also afraid that, over email, you may not be able to communicate things the right way. And so maybe you're not understanding how ill your patient actually is, and you're not able to give recommendations the same way. So in general, again, I think it's a good idea, but I wouldn't judge the reverse, that, that if they don't do this, that there's something wrong with that particular provider. Yes, last question.
How do you really know when it's time to change primary care physicians? If you feel like your doctor's not listening, and you've been there 10 years and you have this relationship with, and I kind of have went through this in the last year, and I felt like my doctor wasn't listening, so I changed and went to a new doctor, and it was scary, I didn't know this person, and I went, to somebody that I felt like that I was trusting, but then so I felt like she wasn't listening to me. So I did make the change. That's why I made the change. And the first thing the new doctor did that impressed me the most, and I've never had a doctor do this in my life, is he gave me a prescription. And I thought, whoa, the first time, but he's not telling me what it is. And I just waited a little bit, and I looked at the prescription, and it was his personal cell phone number. And he said, we want to get to the bottom of your problem. I want to be able to be there when you need me. So he won me over. Okay? I've never had to use his personal cell phone number, but I do have it on my purse and in my phone.
Right.
So, it took me 10 years, though, in knowing that my doctor wasn't listening to me. How long, is there some kind of point or something I should have been looking for that should have led me in a different direction sooner?
Right. Your story I hear so much, because so many people, they have a relationship with their doctor. And as you said, your doctor knows you, and you feel like maybe they know your family, they know your history, they know how you think, they know how you communicate, and so there's a natural comfort to want to stick with your doctor. And for a lot of people, the reason they switch is something bad happening. Like they say, well, I didn't, my mother switched her doctor because she felt like there was a bad misdiagnosis that was made. I mean, you don't want to wait until that point, right? Like that's not, it's a good reason to switch doctors, but you should not have to wait until that point. So I think for a lot of people, there is the sense of, well, if the doctor doesn't listen. But I would say try to give your doctor a chance too. If you say to your doctor, I want to be involved as a partner in my decision making. It might seem a little odd after all those years, to suddenly say, I want to be a partner. But you can even say, I've been looking into this a lot recently, and I really like the idea of partnering with my doctor. How do you feel about this? And if you say all of this and your doctor says, that's not my way, or if they say, oh, it sounds fine, but doesn't actually answer your questions, I think that's a red flag. So I do think that you should give your doctor a chance initially, because maybe they don't know that this is what you want. They're so used to the way that things were that they may not want to change their practice. But if you give them a chance, or give them 2 chances, and they're still not listening, then maybe that's time. But I would be very happy to talk about this and really anything else at the break. I know that we need to move on, and I just want to thank all of you again for your attention and to thank the organizers of this great conference. Thank you.